Hello, everyone. Thank you so much for joining us on the second and final day of the NYU Public Policy Symposium for this conversation. My name is Matthew Plord. I'm here with Taylor Vidston, and we've both been the co-directors of this year's symposium. If you're unfamiliar with the Public Policy Symposium, PPS is an event held every year through the NYU Politics Society that brings together students from a wide variety of backgrounds across the country to discuss some of the most salient issues of our time. And this year, for reasons which I'm sure you can imagine, our topic has been public health policy. And that's included, of course, substantive discussions on pandemic preparedness and response, but also housing, environmental impacts on community health, mental health policy, and so much more. We'll end the symposium this afternoon with a powerful slate of consensus-based policy proposals covering all of these issues, the collective brainpower and compromise of each one of our participants. If you'd like to learn more about this year's Public Policy Symposium, we'll be sending a link at the very end of this session into the chat where you can click to find more information. But now, without any further ado, I'd like to take some time to introduce our guest for today. Dr. Andrew Goodman is a population health expert who worked at the New York City Health Department for more than 30 years, most notably as the former Deputy Commissioner for Health Promotion and Disease Prevention. Today, he continues to offer technical assistance and training, technical assistance for and implementation support for a variety of organizations, provides training for students, policymakers, and others, and conducts research on population health policy and interventions. Dr. Goodman also leads the Community Health Lab at NYU, which promotes the implementation of effective but underutilized policies to improve health, prevent disease, and achieve health equity. So we are so glad that you have joined us today, Dr. Goodman. So without any further ado, I will turn it over to you.
Okay, great. Thank you for that kind introduction. And so today what I'd like to do is spend a little time talking about a potential policy opportunity associated with the COVID and coronavirus pandemic and associated challenges that have gone along with it. And I think here, some of the challenge was really articulated pretty clearly by the leadership of the American Medical Association and some of their testimony to Congress. And I think here they're really pointing out that some of the disparity we see in health outcomes is associated to other factors, both social factors, structural racism, and also it has accompanied changes in our economic system as well. The opportunity, I think, is whether or not this convergence of concern about racial injustice, this intense health issue, and the economic instability that go along with it, whether that convergence really provides an opportunity for some policy change that's much more transformative and much more profound than we're often able to achieve. And so what I'd like to do is really cover 4 areas. One, just really talk a little bit very briefly about what the disparities are. Secondly, talk a little bit about the drivers of the disparities and how those relate to some of the public health approaches to addressing disparity. Third, just a very high-level overview of some of the policy options that have been proposed. And then finally, looking at some of the policy development models to see to what extent we think that this moment really provides an opportunity for some transformative policy. So first of all, I think, as you know, in the spring, there was a dramatic increase in coronavirus and COVID in the United States. Much of it was really driven by the epidemic in New York City. And eventually, as the epidemic subsided in the city, the rest of the country started to catch up with us. And during this period of time, as we were talking about ways in which we could really address the pandemic, we often heard the phrase, and we still hear it to some degree, that we're all in this together. And I guess the question is, are we really all in it at the same level? And I think one of the city councilwomen in the city really sort of captured it when she noted that we may all be in the same storm, but we're not all in the same boat. And I think you can appreciate that when you look at some of the differential rates of impact of COVID when we're looking by race. And this is for New York City, pretty much true for throughout the country. And what we can see here is much higher rates of both developing COVID, getting hospitalized, and dying from COVID for Black and particularly Latino populations compared to whites and others. And I thought it just show how this relates not just in a general way, number of cases throughout the city, but how the cases are really concentrated in certain neighborhoods. And for those of you who are not that familiar with the map of New York City, this is Manhattan. This big area here is the Bronx. And can you see my pointer okay, by the way? Yes. Okay, and here's Queens and Brooklyn over here, and then Staten Island, which is really part of New Jersey, but it's part of New York City for now. So what we can see is that there are really clusters in neighborhoods, and those clusters by neighborhood also cluster other factors. So here, for example, we look at service workers clustered in the same neighborhoods where there are cases, and for the most part, I think a recent study by the comptroller in New York City suggested that about 75, that of the service workers, about 75% are minority population. We also see that there's rent burdened households where the high proportion of their income goes to rent, same neighborhoods, and likewise, it tends to overlap with neighborhoods of people of color. And so when we ask about, or we wonder about like what really led to all these disparities in COVID, there are a number of explanations that have been offered. Certainly the notion of, excuse me, pre-existing health conditions that tend to be higher among African Americans. Also, as I just mentioned, service workers and essential non-health jobs, often overrepresented by communities of color. But also the other explanation for some of the racial disparity are the underlying structural inequities and social determinants that are influenced by bias and racial discrimination. We'll talk a little bit more about that in a few minutes. And also, it's really to think about the importance that place matters. And you may have heard the phrase that the zip code is more important than genetic code when thinking about health outcomes. And we'll talk a little bit more about that as well. So I should also want to just point out that it's not just COVID that is unequally distributed among low-income populations of color. This is a map of diabetes. This is, it's a few years old, but it's really essentially the same neighborhoods where there are high diabetes rates. And this would also be true for a whole variety of health outcomes, whether we're looking at obesity, infant mortality, low birth weight, and others. And importantly, if we think about like one of the more important health outcomes, life expectancy, we also can see that it's not evenly distributed around the city. And the dark areas are lower life expectancy of 75 years to 79. The light areas are longer life expectancy. And here, if we just zoom in for a minute to Manhattan, we're going to look at these two neighborhoods here. So this is East Harlem, life expectancy of 76 years. And then just south of 96th Street on the Upper East Side, people live 10 years longer. And so what we really have to think about is what is really contributing to that. And that's some of the important things that we're going to be looking at. This is a quote from Dr. Mary Bassett, former New York City Health Commissioner. She's now at the Harvard School of Public Health, but really notes that these differences are not due to genetic factors or people making bad choices, which is often the way these are characterized as the causes, but rather it's really these, what she calls the societal forces that are impacted by racial ethnic disadvantage. And importantly, that this can be changed. So often when we think about public health strategies, or especially those related to the health system, we initially will think about, it's really important that people all throughout the city have access to high quality care. And of course, that's important. We also talk about that the public health system needs to have the capacity and infrastructure to really carry out effective pandemic control. And over the years, health departments have really trained and prepared in all these ways to do pandemic control. But in addition to that, the important public health strategies are to address also these underlying drivers, the social determinants of health, and also the determinants of health inequities, which we'll talk about are slightly different. So first of all, just thinking about what the determinants of health are, typically when people think about we want to improve health, people think we really need to make our investments into clinical care. And what I would suggest here is that what we really need to invest in is really more likely the social and economic factors that are really driving health status. And this idea was kind of captured by Dr. Tom Frieden. He developed this model called the health impact pyramid. And essentially you can see that the clinical interventions are at the top of the pyramid, meaning they have less population impact and they're more focused on individual activity. And what he shows is that the most important or the most impactful area in the pyramid is our economic factors, which have the greatest impact. And also, he doesn't have it on here, but these are also the most challenging and difficult to address. So just thinking about what the social determinants are, this phrase has gotten really popular in the past year or two or three, and it's often been used by health systems talking about screening patients for social determinants. But typically what they're really talking about are social needs of patients. For example, a patient that is having trouble finding a home. But what I would suggest is that social determinants are really not characteristics of individuals, they're characteristics of really communities. And over the years, people have kind of tried to come up with definitions that make it a little more accessible. And it's really come up with the idea that it's really where people live, work, learn, and play. And these are sort of 5 areas that are often used in thinking about social determinants. And depending on how you group them, it could be 5, it's not, a precise number, but these are the factors: education, healthcare, your neighborhood, what your the community is like that you live in, and economic stability. And then I would just add that in addition to thinking about these community factors, there is this notion of the social determinants of health equity. And there, what we're really talking about is what determines how these social determinants up here are distributed in populations. So for example, we know that poor housing can be associated with asthma, lead poisoning, and other health issues. And then the question is, why is poor housing distributed in certain areas? And we know from a whole history around housing that there was redlining, which was really a process that systematically denied mortgages to people people of color and people in low-income neighborhoods. And those sets of factors, say discrimination, are another set of social determinants aside from the ones that we talk about here. And those also need to be addressed. And I think that's kind of emerging in this particular era. So what I'd like to do is just spend a couple of minutes talking about what some of the policies are. And it's really, this is just like a high level overview to just give you a feel for the fact that a lot of people are thinking about policy change and thinking about it in a pretty profound way. So here, this is the movement for Black Lives, and I know all of you are probably familiar with with the movement of Black Lives Matter, but I'm not sure if you're all familiar with, the movement for Black Lives, which is a coalition of many organizations that really has a fairly uh, fleshed out policies, set of policy statements that address these different issues. And some of them are related to the social determinants that we were talking about, that there should be better housing, that there should be better jobs, but they're also talking about the causes or the underlying factors or the roots of those social determinants in terms of political power and community control. And so this is an important movement, I think, that contributes to the potential for really dramatic policy change going forward. There's also a lot of policies that have been developed around the Green New Deal. And I know, the most popular is the congressional policy that um, has been promoted by some of the progressive congressional caucus. And then there are a number of other organizations that have come together. One is called the Green Stimulus to Rebuild Our Economy. And it has a very extensive policy analysis of investing in communities, creating green jobs, and dealing with the infrastructure to ensure that and transportation to ensure that there's a reduction in uh, the gases and other factors that are contributing to climate change. There's also policies and policy packages that have been developed to more specifically address structural racism and social determinants. And this is just one of many that are out there. This is from the Urban Institute, which is a think tank in Washington. And this touches on a variety of different issues, from baby bonds, which is literally putting money in the bank of all children so that over the course of years there'll be sufficient funding for those children to have a good education, go to college, and um, have other support. And it sort of plays on the idea that most people are pretty much in agreement that babies probably are not, living unwisely and using money poorly, so that, and it's worth investing from the beginning of life. And then there are some public education reforms, the notion of job guarantees, and this has been put forward that everyone who wants a job should have one. And there are a whole variety of ways in which that could be uh, obtained, particularly through public works projects and infrastructure development. And then finally, talking about uh, racial, addressing racial injustice. And this you've heard a lot about, and we've heard a lot about, which has come under the rubric of, defunding the police, but it's really been around taking some of those resources and investing them in other activities that may be more fruitful in communities. And I think we can all appreciate that when we're talking about mental health issues that in communities that often get a police response are often not the appropriate response. And it would be better probably to invest in other kinds of services. Some of the proposals have been around, focused on neighborhoods. New York City, there's a coalition that you may or may not be aware of that's promoting a Green New Deal. The mayor has a recovery proposal around a Green New Deal. This one has a $16 billion plan. Again, a lot of it is around housing, transportation, and ensuring that there are good jobs associated with them. People have also promoted ideas of housing as a human right. And, we're more familiar with healthcare as a human right, but this goes beyond that. And there are a number of proposals out there that are pretty amazing in terms of really thinking, like, not just how do we nibble away at the problem, which is what we're currently tend to be doing with community organizations working on housing, but really grappling with the true need that's out there. So this home guarantee proposal talks about 12 million units of social housing, which is really housing that's off the private market and available for people who have no income to be able to afford adequate housing. There are a number of topic-related proposals that have come out, many of them addressing the food system. This is a report that came out recently, Meeting the Moment, really recognizing that this moment of crisis provides an opportunity. And here, they came up with a bunch of proposals, some of which are really around, pretty specific proposals around providing more nutrition support, but also having some really system proposals of how we really provide food for anybody who needs it. How do we really organize the regional food systems, and how do we make people who work in this food supply chain have access to safe and well-paying jobs. And then also just wanted to mention, there's always been a lot of talk about economic stability as one of the main drivers to enable people to improve health status. You may have heard of universal basic income, which really is a stipend to literally everybody in the country so that nobody is without food or shelter. I had mentioned before the jobs guaranteed. There are some that are more short-term around unemployment benefits. And the Biden, Build Back Better is actually a phrase that's been used in the European Union and many others of thinking again about taking this little moment, this little crisis, to really see if we can identify policies that would result in dramatic change. And the Biden recovery plan has, I would say it's actually moving in that direction. So I think the last thing I just wanted to touch on is, how are we thinking about this moment, and what's the likelihood of us really achieving some transformational policy change? And this is one of those, there are a number of policy models out there. This is like a multiple streams model. And here we see that these are three potentially independent streams about the problem, the policy, what do we know about it, and the politics, and whether they come together to create this window of opportunity. So that's really the question for us right now. Clearly, we would probably all agree that there are urgent problems. Clearly, racial health disparity and racial injustice is high on the agenda. We appreciate the economic instability, high unemployment, a lot of businesses really struggling, climate change. So these are, a converging set of pretty urgent problems that we're facing in our country and around the world as well. The second question is, do we have policy options that could really address these issues? And some of them seem like we have a lot of issues, policy options. I mentioned a few of them, and some of them are really profound and really would change the nature of our society. And some are more familiar to us, such as Medicare for All, which is really extending health insurance to everyone. But you saw from the list that I went over that there is a fairly robust set of potential policies. And then last is do we have the political mobilization to move these policies forward? And I'd suggest that on the one hand, we do have a lot of political mobilization, probably unlike we've seen for many years, probably the decades from way back when I was in college. And we really thought we were going to change the world, ending the Vietnam War and other potential changes in our country. So anyway, I think there is a lot of political mobility, movement in the country. I mean, obviously, there's also a lot of division in the country and challenges in the country. Yet when you look at the policies that are being proposed, they are clearly beneficial to the vast majority of people in this country. And we know that even a lot of people who are opposing, say, the Affordable Care Act, working with Trump, are also the exact same people who need it and benefit the most from it. So while on the one hand, one might say it's crazy to think about that we have sufficient political opportunity, on the other hand, I would say it's really not out of the question in this moment. This was a graphic from an article about people working in Australia, and they talk about the tough nut to crack of health inequality. And they kind of, make it clear that it's not just getting the politicians on board, but it's really getting the communities mobilized, and that it's really together that we potentially could have an impact. And I think that's important because I think a lot of people, and I know certainly even when I was working at the health department, a lot of our work around policy change was really focused on politicians and senior policymakers, as though they, excuse me, really had the power to make policy change. But I think this really makes it clear that it really never happens unless there's really a strong action and mobilization from the grassroots. That that very often the politicians and senior policymakers are responding to the movement and activity of those in the communities. So I think there are a lot of next steps that public health people and others can really be involved in, and some of it is, I think, just raising the opportunity and the potential impact of addressing social determinants of health. And I think for the most part, when people think about profound health problems and even health disparities, the typical response is to think about healthcare system changes that would resolve those problems. And what I would suggest is that if we're really going to resolve them, we really need to reframe the issue in terms of these underlying drivers. And I think that's something that we could be really helpful in really getting the message out and helping to ensure that people are aware of that. I think we can also play a role in ensuring that there's evidence for the proposed policies. It's really important that we pick things that are likely or to work, or that there's evidence existing that they're going to work. And we in public health and in academic public health can also provide data and evidence to the advocacy organizations that are doing this work, and also provide support to the community partners in a whole variety of ways, both in terms of thinking about policy, theories of policy change, what are some of the packages around policies, and again, really independently serving as advocates to really echo what people in communities are saying. It matters when people in academic settings and other settings sort of reinforce that those are really important changes that would really make a difference. So I just want to end with a quote here, that change does not roll in on the wheels of inevitability. It comes through continuous struggle. And I think that's where we are today, that on the one hand, the convergence of these severe and dramatic problems, COVID, economic instability, racial injustice, they provide this incredible potential for dramatic policy change. And I think we need to join with those in motion and in struggle to make those changes. So I think I'll stop here and take any questions. Thank you.
Thank you so much, Dr. Goodman. That was a fantastic presentation. I really learned a ton about these issues. And I feel very activated to go and make some change on them. So while we wait for people to submit questions, you can type them down in the chat, or you can just use the raise your hand function and ask Dr. Goodman yourself. I'll call on you. While we wait for that, there is one question that was submitted via RSVP beforehand. So this is from Rosalina Lopez. She's an NYU graduate student studying public health management. And she asks, individuals are at greater risk of COVID-19 deaths due to pre-existing conditions that are already represented as health disparities, like you talked about. So how do we address the ongoing disparities in communities of color due to COVID when our fragmented healthcare system has failed to address high-risk populations within the system pre-pandemic? And she goes on to ask, what does the work and organization surrounding these communities look like on the ground?
Well, And I'm sorry, and the very last part of the question was,
Sure, no problem. She said, what does the work and organization surrounding those communities look like?
I mean, what does it currently look like? Well, you don't know whether or what it should look like.
What it
Well,
should look
I
like.
think there are, if you remember the health impact pyramid going back, uh, the well, I can just go back because it's right here. So when we think about like what we should be doing around those disparities, I think in fact, a lot of the work is not just making sure that clinical systems work better, though there is a lot of activity going on to do that. And to their credit, I think health systems are increasingly trying to link patients with social needs to social services to support them. So, and I know some of the Medicaid redesign efforts in New York State and other states have really worked very hard to make those linkages. So that's good, but it still tends to be up here in terms of impact. Public health agencies have often really worked on this level, which is changing the context to make individual default decisions healthy. So, for example, we know tobacco is a problem, and we know that by raising taxes or making it difficult for stores to sell or advertise cigarettes in the stores, we're making it easier for individuals to stop smoking. And that's important. And likewise, there's a lot of work in communities around food issues, around schools and food, around availability of healthier foods as well as less availability of unhealthy foods, whether it's a soda tax that's been done in certain cities. So there's a lot of work that we can do around in an ongoing way to try to address those conditions that are putting people at risk: obesity, diabetes, heart disease, things like that. But then I would argue that the additional thing that we often are really not focused on as much as we could be is really this bottom layer of the pyramid, which is really these social determinants that we talked about today.
I have a quick question. So this might not have an answer, but with all of these issues, and I think one thing that we've noticed during the symposium is how interconnected they all are, which is also something you've mentioned. But where do we start? Is there like a certain issue that needs to be tackled first in order to find better solutions for other issues, or is it kind of a all needs to be done in one go situation?
So, that's a challenge that many people are grappling with. And my sense is that, well, I guess there are two things. One is you could imagine a package that's not like totally overwhelming of 4 or 5 complementary policies. And it could be around schools, access to food, some things around racial justice. That could be a core package. But I think in the end, what tends to happen is working locally. I think you really have to start where people are and what they're interested in and what they care about. And you probably can't go wrong with doing that. In other words, people, if you go into any low income minority communities in New York City, anything that people will identify are issues, they are issues of importance. And the constellation of either individual leadership in those communities or the particular circumstances around whether it's a food issue or it could be a transportation issue, they just are very, very specific to those neighborhoods. So I think when one's working in the neighborhood, one really has to start where people are and around issues they care about. And and typically that's fine because they all kind of lead to each other anyway. On a national level, I would hope that uh, either some of the national political movements will hopefully start to consolidate some of the policy issues into a few, or a handful of key policies so that there would be a package that a lot of people could relate to. And then one could say you could start working on any of those issues that really make sense where you are. I don't know if that answers your question, but I think it's sort of one of these things where you start really depends. And I think one of the things that we've learned over the years is that uh, people it going from external to a community to try to work with people, it's very hard to go bringing your ideas and trying to set the agenda unless you're really. It's probably more important to just be responsive to what people are already caring about.
I have a question, if I may. It's more about kind of the ethical frameworks of some of the things you talked about, and less about the public policy themselves. So bear with me. But I think I wanted to ask. You talked about a few really major developments. They would be major developments if implemented. Things like universal basic income and what's it called? A jobs guarantee for through government works and things like that. I want to ask you, what do you say to people who find themselves really concerned that through becoming more and more dependent on government agencies and bureaucracy as a major part of their lives, that they're concerned that kind of volatility in the political atmosphere makes it so that with that further dependence, later in the future, they're concerned that those things get ripped away, that they lose maybe that universal basic income one day, or they lose that jobs guarantee or those benefits that come along with it. What do you say to those that are really concerned about that what they would describe as overreach?
Well, I think there are two issues that, or at least that you brought up. One is, the notion of what's the role of government, and whether there's overreach. The other one was whether, the sustainability of things, and how that, whether things come and go because of different political uh, forces that are in power at a given time. I guess I would say that, um, well, first of all, from the public health perspective, the core value of public health is social justice. And social justice means that the society provides everyone with a fair and equal and a fair and reasonably equal opportunity to be healthy. Now, it's you can imagine that there are certain things that can't be provided by an individual, but must be considered as our common goods and something that we share in society. And there are a few things that people, agree are things that we should solve as a common issue. We have firefighters and fire protection. I mean, there was a period of time when there was private fire service, but now we kind of all agree we should chip in and have a fire department. We agree that kids should go to school, that there should be education. And so the question is, what are the things that we agree society should provide as these basic rights? Many of us agree that healthcare should not just be available if you can pay for it, but we should provide that. So I think, there are extremes on the, if you look at the two, ends maybe of a political spectrum, there are those who feel like individuals have to solve everything for themselves and we should have no government. And then others who say, if we're going to have government, government should provide for the common good. That should be our outlook. And we are rich enough as a society that we can actually afford for everybody to have food, clothing, shelter, education. And why would we not do that if we have that, capability? Um, so I think it's, it, from the ethical and, fairness perspective, we would say that the policies that are being proposed around these common goods for, the society. Those are the fair way that we should organize our society. And that doesn't mean that people don't have opportunity to, have individual choice and activity. In fact, I think we could appreciate that if some of those common goods are addressed, it increases your individual opportunities because you're healthy, because you have food, etc.
All right. Well, I think that kind of brings us to the end of our time. But thank you so very much, Dr. Goodman, for this really interesting presentation. I think it adds a lot of depth to the conversations that we've had earlier this weekend about our various policy issues within public health, and provides a lot for us to think about in the future, and for our last two discussions later this afternoon. Um, but that kind of concludes our time. So thank you very much again, and thank you everyone else for attending this session, and I hope you all enjoyed it.